Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Each episode is designed to break down complex medical and legal topics in a way that's clear, accurate, and grounded in evidence, without fear, misinformation, or sensationalism. Whether you're a healthcare professional, attorney, gig worker, parent, or simply someone who wants better understanding of how medical events and legal responsibility overlap, you're in the right place. Let's get started. Quick story to start. A patient called me after a telehealth visit feeling more confused than helped. They'd shown their rash on camera, the clinician said it was probably allergic, and the visit ended with no clear plan. 2 days later, the rash worsened and they ended up in urgent care. That outcome could have been avoided with a few different steps on both sides. Today, I'll give you a simple, nurse-developed playbook so your virtual visits actually lead to clear answers and reliable next steps. Let's separate medical fact from fiction and make telehealth work for you.
First, myth busting. There are a few common beliefs that trip people up. Myth number 1, telehealth is only for minor stuff. Not true. Many urgent but not life-threatening concerns are appropriate for telehealth, and clinicians can triage effectively if you give clear information. Myth 2, I won't get medications or prescriptions through telehealth. Often you will. E-prescribing is widely used, but there are limits for controlled substances or certain local regulations. Myth 3, video means the clinician can see everything they need. Video helps, yes, but it doesn't replace hands-on assessment for some conditions. What matters most is what you prepare and how you communicate. Provide good visuals, a focused history, and be ready to ask for an in-person follow-up when needed.
Now let's get practical. The before-visit checklist. First, tech basics. Use a charged device with a recent browser or the clinic's app, and test your camera and microphone 5 to 10 minutes before the appointment. If video isn't possible, a phone visit is still valid. Call ahead to confirm. Lighting is key. Face a window or lamp so your face and any problem area are lit from the front. Avoid strong backlight. Privacy. Go to a private room, use headphones if you can, and close doors so conversations remain confidential. Prepare and share a concise medication list. Include doses and when you last took them, and upload photos of rashes, wounds, or swelling to the clinic portal before the visit. A still photo is often clearer than live video and can be reviewed carefully by the clinician. Also, send concise pre-visit information, a short problem-focused summary, for example, 3-day cough, worse at night, no fever, mild wheeze at end of exhale, and attach photos. That helps clinicians prepare. If you need an interpreter or accessibility support, request it when you book. Many systems can add those services to a telehealth visit. During the visit, clinicians usually follow a structure: focused history, directed visual exam, problem-focused questions, and then a plan. Your job is to be specific and concise. Use short scripts. Instead of, I don't feel well, say, I have a sore throat for 3 days, fever to 101 last night, trouble swallowing solids. When describing pain, use a number and location. Pain 7 of 10, sharp, right lower abdomen. Those concrete phrases help remote assessment. If the clinician asks you to show something on camera, use simple moves. Point to the exact spot, move slowly, and hold still for a few seconds. If a parent or caregiver is present, have them help with camera angles or palpation under direction. If the clinician seems unsure, ask explicitly, would an in-person exam or imaging change your recommendation? That question often opens the door to safer next steps. Remote assessment tricks I teach patients every week. Use household items to help show symptoms, a flashlight to check pupils or throat, a spoon to depress the tongue, or a pocket mirror for ear views if needed. For respiratory complaints, try a short walk on camera or count out loud while breathing to assess breathlessness. For abdominal pain, you can point to where it hurts and try gentle pressure while describing increased or decreased pain. But know the red flags that require in-person or emergency care: sudden severe shortness of breath, chest pain with sweating or fainting, new severe neurological changes like weakness or confusion, uncontrolled bleeding, or signs of sepsis like very high fever with rapid heart rate. If any of those are present, call emergency services right away. Do not wait for a telehealth visit.
Logistics and your rights. Prescriptions are commonly handled by e-prescribing to pharmacies. If you need a controlled medication, be prepared for more restrictions and sometimes an in-person requirement. Billing surprises happen. Ask when you make the appointment whether it's covered by your insurance, whether there's a copay, and if the visit will be billed as telehealth or as part of an in-person service tied to a clinic visit. Consent and privacy. Clinics should get your verbal consent for telehealth and explain privacy limits. If you want your visit notes, ask for them. You have a right to your medical record. If anything feels unclear, say, "Can you summarize the plan and next steps in one sentence?" That helps create a clear, repeatable plan you can act on.
Recap and 3 takeaways you can use immediately. Takeaway 1. Prepare. Test your tech, take good photos, and bring a concise medication list. Takeaway 2. Speak clearly and use short scripts like 3-day cough, fever last night, trouble breathing at night. Clinicians can triage faster with specifics. Takeaway 3. Know red flags and don't hesitate to ask for an in-person exam when you need it. Bonus tip, ask for written visit notes or a 1-sentence summary of the plan before you log off. Those 3 actions alone will reduce confusion and speed appropriate care.
If you found this helpful, I've created printable checklists and sample scripts that walk you through before, during, and after a telehealth visit. You can find them at FAQ by NurseJessicaConsulting.com. If this episode made telehealth feel more doable, please subscribe so future episodes reach people who need practical, evidence-based guidance. And if you have a telehealth question you want covered in a future show, email my team through the website with a short description. Subscribe, share, and let's make virtual care actually work. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at faqbynursejess.consulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.